this show.
Well, this week it is Homelessness Week, and advocates say some of Australia's most vulnerable people are being discharged from hospital straight back into homelessness. And this is because of mental health and housing systems that just aren't working together. Joining us now is the CEO of Homelessness Australia, Kate Colvin. Kate, good to see you. Thanks for coming in.
Hi, Kate.
Hi. Can you tell us about the impact mental health has on homelessness? How many people are affected by it?
Look, we estimate there's about 31,000 people that are stuck in this cycle of going into acute mental health care, being discharged into homelessness, and of course if you're on the street your health is going to suffer really badly and people end up back in acute mental health care. So, you know, the problem is partly that government just doesn't fund the ongoing support that people need after mental health care, and also don't fund housing for people in that situation. So there's just no option but people just being discharged into homelessness or into some sort of, you know, often dangerous kind of rooming house where their health continues to suffer.
We heard about this when we were on the road in Newcastle a couple of weeks ago, the fact that people, if they're suffering from their mental health and they are homeless, they're less likely to then be able to seek out support or fill in the paperwork required to get some of the support and things like that. What can be done to look after some of these people?
Look, internationally there's models that we know work. So getting someone into housing and providing the wraparound support they need is shown time and again to be the solution, both for people's mental health, so their well-being dramatically improves, and for sustaining an exit from homelessness. So instead of that, we don't have that ongoing support, we don't have that housing, and it sort of falls between those two departments, mental health, homelessness. Governments don't fund that piece in the middle, but actually we've got an upcoming negotiation around the mental health and suicide prevention agreement. So there's a great opportunity for government to fix it. It's federal and state governments together, and we know this is what works, and so that's the opportunity.
Where do they end up, I guess, in a scenario like this? Do they end up in a police station or do they end up in an emergency department? I mean, these are places that are not that well equipped generally to deal with these people.
Yeah, really great question. Look, people end up sleeping rough, so we've had a really big increase in people in this situation sleeping rough. They do end up sometimes coming into contact with the police. They come back into the emergency department. So there's enormous pressure in emergency departments, and that's often, I mean, it's the whole community, but it's also people experiencing mental health challenges, and of course acute mental health beds are full. So people then get just turned away from mental health, from emergency rooms, and one of the really tragic outcomes is suicide. So we know that among this group, suicide's really common. People who are rough sleeping are dying decades earlier than other Australians, and 1 in 20 of all suicides in Australia is someone who's been recently homeless. So it does need that additional mental health investment to just really take care of this group.
Do you think that, you mentioned that there are two different departments, state and federal governments, do you think that's why it's been difficult for them to tackle this issue? Because it is, you know, it has to take an all-government approach and department approach.
Yeah, that's absolutely the problem. So it sits between federal and state government, it sits between departments across government, and it needs a whole-of-government approach. And that's where it needs that sort of really strong leadership, starting with the federal government to say we're going to fix this problem and look and tie together these parts across government and make agreements with the states to fix this problem, because we can't keep going on. It's devastating for the people involved, and it also puts so much pressure on the emergency department, on the acute mental health beds, on the system that is putting a lot of resources into responding to people, but without the outcome because it's not all tied together.
Kate, before we let you go, at various points politicians have stood up and they've said grand things about ending homelessness for kids, for adults. As a rich country, is this something that Australia could actually solve relatively quickly if we chucked enough money at it?
Yeah, absolutely. It's partly about investing, and it's about getting the social... I mean, social housing makes an enormous difference, and Australia just doesn't have enough. So that's one of the main reasons why we've seen a big increase in the number of people experiencing homelessness. to be honest, most people experience homelessness just because they can't find a home they can afford. But then there's also that support piece, so providing people with the support they need to stay housed if they get housed and to get into a home, and investing in that is the other part of the piece. And if we had those pieces of the puzzle together, we would absolutely be ending homelessness.
Kate, thank you very much for coming in.
Thank you.
Thank you, Kate. Now it's time for some music news.